This is John Milner interviewing Daniel Reid in his home in Santa Cruz, California. And the date of the interview is May the 5th, 1995. Well, Dan, thank you so much for being willing to talk to me about your experiences as a social worker, and appreciate this opportunity. One question that we've asked the different persons being interviewed is how you happened to get into social work.
Well, kind of through the back door. I had been pursuing, after I got my BA from the University of North Carolina, I'd been pursuing acting and had spent some time in New York, and everybody told me to come to California, that that's where the opportunities were, and came to California and became quite disillusioned with what was going on in the acting field in Los Angeles.
Many people are.
Yes. A friend of mine was working for the Bureau of Public Assistance. It was called the Bureau of Public Assistance then, down on Adams and Grand, and said, why don't you take the test and, come work for welfare. And so I did. And that was my introduction to social work.
And this was in Los Angeles?
Yes.
Very good. And what types of cases did you carry there?
Well, I had 104 cases.
Wow.
And each case had an average of 4 kids. And what I would do is I was to go out and confirm their eligibility, plus I was to work to get them off of welfare, and too often I was also supposed to be an investigator, which I would never be, or I don't think I satisfactorily fulfilled that requirement of the job, to make sure that somebody else wasn't living in, the back room of the house.
And these were aid-to-dependent children cases?
That was it, A.D.C.
A.D.C.
In fact, then it was aid to families with dependent children.
That's right.
A.F.D.C.
That's true. I remember that, Matt. And so you worked there a full year?
Well, I did. I worked there about a year and a half, and I really liked the work. I liked my clients. I felt I learned so much from them, and really respected how they were able to manage on a small amount of money that they had.
Sure.
And, and I liked, being able to connect them up with different resources and, had some successes, but I didn't like the bureaucracy of the county.
Mm-hmm.
And so I was thinking of leaving, and somebody said, well, why don't you get a master's, because, certain aspects of this that you like. And so I looked into that and sent in an application to USC, and, got accepted, and then got a scholarship.
You entered USC what year?
In 62.
And you graduated then in 64?
Yes.
Yes. That's a long time ago. And while you're in school at USC, you took field work?
Yes.
And who were your supervisors, if you can remember?
Well, my first year, I was placed with Fred C. Nellis School for Boys. And they had a small treatment program that was treating some of the more disturbed boys, and it was a very psychoanalytic model. And my supervisor was Mel Hendon. And I had just a few cases all year, and most of the time I was only carrying 2 cases. But I had to look in detail at everything that I was doing. So,
yes, this was the time when they were trying to improve the services in that institution.
yes.
Wasn't it? Because it was an institution that had a bad reputation for a long time.
I ended up doing my thesis on the school.
On the school.
Yes.
Very good. That was before they brought Father Kaufman in from Boys Town.
No, this was after. Father Flanagan came in the 40s.
Flanagan, yes.
Yeah.
And he was a total failure when he...
Well, yeah. What he did was he opened up the doors, and kids got out in the neighborhood and created all kinds of havoc.
I remember knowing about that. Very good. And you had 2 cases.
Most of the time.
Intensively, so low caseload for a student.
It's a very low caseload.
Yeah.
But I learned a lot.
And then in your second year, what field placement?
Second year, I was with the Family Service of Los Angeles.
Uh-huh. And what types of cases did you carry there mostly?
Oh, I carried a great range. The school was concerned that I had had so few cases my first year, and so they made sure that I got great range the second year. And I had couples, individual adults. I had families, children, seniors, and people with just an array of different diagnoses.
Really rich experience.
It was a very rich. Both years were very rich experiences for me.
Yes. You said you couldn't remember your supervisor there.
Well, his last name is Rock, and I remember him very well, and how he was with me, and all that I learned from him. But I'm blocking on his first name.
Yes, that's been a long time, so it's easy to do that.
He may have well had us calling him Mr. Rock. He was that kind of supervisor.
It's hard rock.
Yes.
Who was your casework teacher? Do you remember in the first year?
Oh,
the second
of course
year?
I do. Alice Overton.
Yes.
Yes.
Yes, and she was certainly remembered a long time for her good work.
She was wonderful. She was very, very good for me. And I think she really gave me my grounding in social work.
Yes.
And was talking about work with families at a time that nobody else was, and talking about community work. And she was quite a woman.
Mm-hmm. Can you remember what the emphasis of the school was at that time? And
well, the emphasis in those days, it was casework and group work and community organization.
So it was really generic.
Yes.
Yeah. And
you had to specialize in one, casework or group work or community org.
You became the caseworker.
Yes.
Very good. When you left school, what was the first position that you took?
It was with the Hathaway Home for Children in Highland Park, and I was a social worker with responsibility for a cottage with 8 kids, and responsible for their treatment and work with the cottage staff, which was, at that time, one house parent.
Mm-hmm.
And after I'd been there a while, I got that changed to where had a team brought some people in from the recreation department and had them work with the house parent, because it was far too big a job for a house parent. Mm-hmm. But so it was to work with the house parent. It was to work with the school or schools. There was a school on ground, and of course coordinated with the teacher at the home and with the schools in the neighborhood when the kids would go there. Would also work with the families of the kids.
And who's director of the agency at that time?
Chet Latch.
Chet Latch,
Yes.
And he later, I guess he stayed with Hathaway for many years.
Oh, yes, he did. Yeah.
Until his death.
And that was, I understand, just a couple of years ago.
That's right.
Yeah.
So, and working at Hathaway really made you decide that the field of child welfare was the one you wanted to follow?
Well, actually, John, I think you were the one, because you had kept telling me that's what I should do. and when I was looking around for a job, you suggested Hathaway.
I've forgotten. Yes. And are you glad you chose that field?
Oh, absolutely. Yeah, I think that there was certainly a real need for males to be in that field, and I do think that it was a natural for me. Somehow I just related well to kids.
Yes.
And they related well to me.
Yes. I think I knew that about you, even then. And you were at Hathaway for how long?
I was at Hathaway for 3 years. And 2 years I was with the home in Highland Park, and then the third year I went out to their ranch out in Pacoima, their Cecil B. DeMille ranch.
Yes, and that was relatively new, the ranch part at that time.
Yes, it had been in operation a few years before I started working there.
Uh-huh. Was the emphasis of the work there almost identical to the original Hathaway?
It was. There was certainly a difference because of its isolation. And it was isolated. And there were a lot more things, too, that you could do using that setting and using nature. But I would say there were far more similarities than there were differences.
Weren't they bringing in the parents of children to live there temporarily?
No, they never did that.
They talked about that as a plan at one time. Yeah, very good. And then from Hathaway, you went to what agency?
Well, I went to work for USC as a fieldwork instructor and supervisor.
And you were supervising then in what agency?
I was supervising in the Bureau of Mental Health.
And can you describe a little what the type of services might have been that you were doing?
This was aftercare for people who had been in state hospitals.
Yes. And tell me a little about what that experience was, a little more about it.
Well, I was supervising 6 graduate students who were doing their field work. And it was an interesting period, and I felt certainly I learned about that particular, population. But it was kind of a deviation for me because it was the one time in my career that I didn't work with kids.
Yes. And
And a lot of the experience, too, was, being on the faculty of USC and being involved in, various committees.
And the patients were taken out of the hospital and placed in aftercare homes?
Yes.
And then supervised in the aftercare home?
By the students, right.
By the students. That was quite a successful program, wasn't it, at the time?
Yes, it was. Yes, it was.
I remember the research on it showed that it had been quite successful effort to keep people out of the hospital.
Yeah.
Very good. And you were there how long?
For 3 years.
And then you went where?
Well, after that, I moved to Santa Cruz.
And then you did what in Santa Cruz?
Well, I got a job with mental health in Santa Clara County, working in Gilroy and children and adolescent services.
And that was a county program?
Yes.
And you placed them, what, in foster homes, or?
Oh, no, this was mental health services and was outpatient.
I see.
And so when I went there, I was the only professional in that whole area of the southern part of Santa Clara County, Gilroy and Morgan Hill, and there were very few services, and the schools just started sending me all their kids, and I was seeing like 50 kids a week in individual and group therapy, and seeing their parents, and then I realized the need for services there, and so I started seeing what I could do about developing programs, and help set up a program that is still there. That's a counseling program for kids, and also started doing more educational programs for teachers and parents.
Uh-huh. And that was about what year when you went there first?
That was 1970.
Uh-huh. And you were there?
I was with mental health in Santa Clara County until '84, but I was down in Gilroy for about 3.5 years, and then I transferred over to a program in Las Gatas.
Uh-huh. Did this mean working with other disciplines a lot?
Well, it did. It meant certainly working with psychiatrists and psychologists.
And did you find that social work really was helpful to people as well as the other types of services that were given there?
Well, when they let me do social work, it was very helpful.
Yeah.
And initially in mental health in the early 70s, you were able to get out in the community and organize and, teach. And but then later it got to where in the late 70s and the early 80s where they were pretty much demanding that all you do was stay in your office and see clients, and all of these restrictions on what you could do, and it was like doing private practice in a mental health agency.
Yes. So you saw some change.
So there was a drastic change.
Uh-huh. Uh-huh.
And morale was terrible toward the end of the time that I was there, and really a very dehumanizing situation for all of the staff.
Yes. And that was sort of the beginning of some deterioration of the whole mental health program in California, wasn't it?
I think it was, yes.
Uh-huh. So that made you decide what in your life?
Well, that made me to decide to leave the mental health system and work on my own in private practice.
Mm-hmm. And where did you establish your office at that time?
Well, initially both in Santa Cruz and in Las Gatas. Uh-huh. And I was in Las Gatas a couple of years, and then moved my practice entirely to my own community in Santa Cruz.
Uh-huh. And what did you do to build a private practice for yourself? Tell me a little of the early experience.
Well, I just let people know that I was in practice, and that time I was doing some teaching for UCSC Extension, and I think that helped build my practice.
Yes.
And for a short period of time I worked for Family Service in Santa Cruz, and also for a short time with Parent Center, and got to know people in the community, and that helped.
So you really started out in part-time private practice.
That's right.
And gradually developed your...
Yes.
Were many private practitioners, social workers in the area where you lived, or were you the only one?
Oh, no. By the time I got into private practice, there were quite a few. social workers and psychologists and psychiatrists, yes.
Did most of them do it on a part-time basis or full-time?
Most of them, I would say, started out on a part-time basis, and some continued on a part-time basis.
Uh-huh. And what types of cases did you carry in private practice?
Well, it was a range, but mostly I was known for working with children, and so I would say over the years, at least 3/4 of the referrals I get are children or child-related.
What particular kinds of problems?
Oh, it's the whole range. From separation anxiety, school refusal, depressed kids, conduct disorders, children of divorce, children who had experienced death in their family, the range.
Yes. And you've found that a satisfactory type of practice?
Yes, I have.
Yeah. Okay. In addition to seeing cases, I understand you've done a lot of community work. I wonder if you'd talk about that.
It's interesting that being in private practice, or while I've been in private practice, I've done more community work than I did in those latter years at mental health.
And did that as a volunteer?
And have done that voluntarily, yes.
Uh-huh. Tell me about what you've done in it.
Well, I've been quite involved with child abuse and the Child Abuse Council in Santa Cruz, and was involved in the mid-'80s for several years, and then became re-involved in 1990, and have been involved since. Was it 1991? And the Child Abuse Council had gone defunct here after the earthquake. And I started up a group following a case here that got some notoriety and was in the papers all over the country, the Ruby Pointer case, where they found these children in a feral state. And the mother had several children taken away before, and one judge had tried to order that she never have children again, and of course couldn't do that, and then she did, and there had been involvement with Child Protective Service, but no one had been to the home for some time until they were caught, even though there were numerous reports, and the police went out, and they were able to get in because they saw marijuana, and got in and found these children in this horrible state. And so I started calling around and to get other people involved to say, can't we do something about what's going on? And formed a coalition for the protection of children, and wrote documents which we sent to the Board of Supervisors and the judges, and had community meetings, and worked towards making changes, which we were able to get some changes made. And then after a year of doing that, we merged with the Child Abuse Prevention Council and then continued working.
You really took leadership in that, didn't you?
I did, and it was something that was really just coming out of wanting to do something. But I guess I did.
Yes. What sort of composition of people made up the council?
Other therapists, attorneys, directors of social agencies. And first we had a pretty small board, and now that's increased, and we have a child psychiatrist, and we have someone from the district attorney's office. We have, and people from various agencies.
Do they continue to be active?
Oh, yes.
So there's genuine interest in continuance of this?
Yes.
Good. And aren't you planning to have new offices or new buildings for the council?
No, not...
I thought that the college nearby...
Oh, what that is, one of the things that I've been working on for about the last 4 years is a multi-disciplinary investigation center for children.
Can you describe what that would be?
Yeah. Well, first let me say this came out of my practice, and one of the things that, talking about Alice Overton, one of the things I learned from her, she said, if you see things in your own practice that are affecting your clients' systems that aren't working, then do what you can to change those systems. Mm-hmm. And I was working with sexually abused children, and I was seeing what happened in those investigations. Not so much with physically abused, although there's certainly problems there, but more with the sexually abused children, where they're not being able to adequately, or they weren't adequately investigating these children. They were sending out people who weren't trained to do this. There were multiple interviews of children. And so I started doing my own research and finding out what people were doing, and had heard about this new thing that was happening with the multi-disciplinary investigation centers, and first started working through a local clinical social workers group and writing letters to people. And then in the council did the same thing. We set up a court committee to look at problems in the court system that were affecting children. And then through CAPC, I continued to pursue that and worked with the district attorney, put on workshops that educated people about this, and
yes.
And now it's happening, and I'm real happy.
Good.
Yeah.
And what were some of the court problems that you were working on? What?
Well, that was one of the ones that we were working on. Another one that we've been working on is attorneys for children, and getting a clear definition of what is an attorney for children, because most of the attorneys are appointed with no training in working with children, no experience in working with children, and they usually end up being the attorneys for one of the adults or the other in these family court cases. And we were also working on the evaluations of children, and got together a manual for the county on evaluations, and have been guaranteed that in the future there will be someone with a master's degree doing these evaluations. So those are some of the things that we've been working on.
And how about the judges? What have been their qualifications for being judges in children's court?
Yeah. Well, we have been fortunate in the county in having some judges who are really interested in the job. But there was rotating every year at the judges in family court, and we've gotten that changed to where now they're staying several years. And there's certainly the need, even though these judges care about children, for education. And we've worked at that by having them on panels of workshops and by sending them documents and sending them research material and in various ways, trying to have ongoing education for them.
Good. You have been doing some teaching throughout your career, and I know that most recently it's been at the University of California in San Jose, isn't that correct?
Well, it's UCSC, University of California, Santa Cruz, and through the extension.
Oh. describe what you've...
Well, I started that in the late 70s, and this was when I was working for mental health, and I was looking at children. When I worked for mental health, even in the later years, I was still doing some consulting to schools on a minimum basis, and I was consulting for what they then called EH classes, educationally handicapped, in elementary schools, and would go over a couple of hours a week. And I was also working with some depressed client adults and doing some reading and work with them, and I thought, this applies to these kids. And so then I started researching what had been done in the way of, what there was out on childhood depression, and there was very little. And so I started teaching on that for UCSC and taught workshops for a number of years on childhood depression, and then I also taught a workshop on ways to use literature with children to help them with crises in their lives, and then a workshop I did with a school psychologist, a 4-day workshop, which we did a number of times for educators, teachers, and principals on how children learn. Mm-hmm. And then the university asked me if I would put together a group of workshops on child depression, on child abuse, and on divorce. And I did that. And then with the workshops on child abuse, and also working in that field and having worked in an agency that worked with child abuse, seeing what need there was for education in that, set up a child abuse studies program at UCSC. Mm-hmm. And initially that was going to be a certificate program, and ran into some problems with that, but it continues as a child abuse studies program, and I've put on over 60 workshops in that program alone. And have also put on other workshops on divorce, attachment, working with families, art therapy, and that's been a very rewarding experience to bring in top people in the country.
I would think so. And this has given you an opportunity to get to know them when they come.
Yes, it has.
Now, that's very valuable to have that. And didn't you do some supervision for the school at San Jose?
Oh, for 2 years I taught a class on on work with children for them.
Where was that taught? On campus?
No, that was in an off-campus program that they had. And this was entirely for students who were placed with the Department of Social Service, who were working with children. Uh-huh. And I did this 1 year in Salinas and 1 year in Santa Cruz.
Uh-huh. Did you enjoy that teaching experience?
It was very rewarding. Yes, it was. And I continued over the years I think I've been working with interns all the time I was working in mental health, and most all of the time I've been in private practice and working with interns.
Excellent. Excellent. Who was the dean at the San Jose School while you were doing that, if you can remember?
Dieppe.
Andy Dieppe.
Yes.
And he's a graduate of the USC school, isn't he?
Yes, he is.
And he's still at San Jose?
He's still there. Yes.
Very good. And their student body has a great many Hispanic students, doesn't it?
Yes, it does. Yeah. That's something they've really gone after.
Uh-huh. Do you have any idea of the percentage?
I don't know what it is, John.
Mm-hmm. No, it's been interesting that they've featured training for Hispanics.
And they also demand, I think I was telling you earlier, that they demand that all of their students be able to pass a test in Spanish, of conversational Spanish, and being able to read and write Spanish.
That's very interesting. I didn't know that.
Yes.
Very, very interesting. I guess Andy brought that around.
I think he did.
Very
Yes.
good. There. Let's stop a minute. Oh. I know you've been very busy in practice, but I wonder if you've had time or any interest in writing publications or doing special research projects along the way.
No, I've done research just for my own benefit and also for teaching, but not for writing, and I haven't written or published.
Yes, that's something you should do because you've had a very rich experience in that. Hope you will. The experience you had before you were a social worker as an actor and in theater, I wondered if you see any value in that kind of experience as it might relate to doing social work or being a social worker.
I think that the one value, or the most valuable thing was when you're acting, having to study a character and what motivates them, and looking at how people relate, understanding something about cause and effect, understanding about behavior. I think that's the primary benefit.
And didn't much of our knowledge of human behavior come out of the literature?
Yes, it came out of literature and it came out of drama.
Right. So, have you had any actor friends who have become social workers?
Actor friends? No, I have a couple of colleagues now who've worked in theater in the past, or several colleagues, but none who I worked with in theater. No, none of them have gone into the field.
Yes, yes.
That I know of.
Yes. Have you regretted leaving theater to be a social worker?
No regrets.
Good. You found it equally or more interesting and valuable to
And
yourself.
more satisfying in the long run. Yes.
Then, in addition to all your professional work, I know you have hobbies at which you also work very hard and are accomplishing a great deal. Would you tell me about them?
Well, the hobby I've had for the longest is photography. And I've been doing that since the early 60s and continue. And in the past year, I've started working in clay, and I'm very much enjoying doing that.
So you're doing creative clay work and certainly photography in a creative way. And where have you gone to photograph?
Where have I gone
Yes.
to photograph? Well, I photograph what's around me. I like to photograph when I travel, and I photograph nature and people, and I like to photograph walls.
And what's on walls?
Yeah. Well, what's on walls? Torn paper and signs, and but I like very much to photograph people and nature.
Yes. I hope you keep them up because I think you do them very well.
Thank you.
Well, thank you, Dan, very much for your willingness to talk to me. And I want you to be a part of history of social work in California.
Thank you, John.